So thank you for inviting me here today and our program. Diabetes education is something I'm very passionate about. I've been a nurse for 20 years. And one of the things that got me into nursing was working for the Camp for Youth with Children with Diabetes. And I just really love empowering people to be able to self-manage their diabetes and the disease process. So this is something that I'm very passionate about. So hopefully I can help clarify those questions today. So what we're going to talk about today, I'm going to give you a high-level overview of diabetes management. So we'll talk about what diabetes is. We'll go into some details about the diagnosis, the disease process, the different types of diabetes, the diagnostic criteria for that. When should people be screened, or who should be screened for diabetes? Also looking at some management strategies, and then also some resources. All right. So I always start off with anything, whenever I'm doing talks for different groups, I always like to start off with prevalence. That kind of gives you an idea of what the significance of the problem or issues are. So with diabetes, there's about 38 million people in the US that have diabetes. So that translates to about 1 in every 10 adults have diabetes. 1 out of 5 don't even know they have diabetes. Okay, so what that tells you is that there's opportunities for further screening and awareness. A lot of people don't even realize that they have diabetes because a lot of times the symptoms or early symptoms of diabetes are easily explained, like fatigue or slightly increased thirst or different things like that. And some of those things can be easily explained by other things going on. Like in the summertime, you might be drinking more because it's hot. So a lot of times people don't recognize the early symptoms. So early screening is really important because the early initiation with treatment and management is very important. And then pre-diabetes affects about 98 million people. And that's 1 out of 3 adults. And then 8 out of 10 people don't even realize that they have pre-diabetes and are missing some opportunities for prevention or delaying onset. So what exactly is diabetes? So regardless of which type of diabetes someone has, diabetes is a metabolic disorder. So where it affects the way carbohydrates are metabolized in the body. And then depending on the type, and we'll go into the different types of diabetes, that's where the breakdown is, or the problems that arise. So diagnostic criteria, so somebody would meet criteria for diagnosis of diabetes, and there's a couple different tests that can be done to screen for somebody for diabetes. There's what's called a hemoglobin A1C, and that's a lab test. And that tells somebody the average of their blood sugar for the past 2 to 3 months. So it doesn't really matter if somebody, I hear a lot of times people are like, well, I had a large meal the day before. This value won't matter. It won't be affected by that one large meal because it's taking an average of the blood sugar for the past 2 to 3 months. So pre-diabetes was an A1C value of 5.7 to 6.4, or 6.5 and higher would meet diagnostic criteria for diabetes. Fasting blood sugar levels, and this is 8 hours or longer with somebody not eating or taking in carbohydrates. Pre-diabetes is written, it falls in the range of 100 to 125, and then values of 126 or higher would meet criteria for diabetes diagnosis. And there is what's called an oral glucose tolerance test, where you go in fasting and then you drink a god-awful amount of sugar, and then they test your blood sugar at 2 hour intervals. And then if that value comes back 140 to 200 range, that's pre-diabetes range, and then diabetes range is 200 and higher. Okay. So risk factors, and this is straight from the standards of care for diabetes, but adults who are overweight, and overweight is classified a BMI greater than 25. Asian Americans should be a BMI greater than 23, who have additional risk factors, such as a family history of a first-degree relative. Anybody who has certain ethnic groups are at higher risk too, which would be African American, Latino, Native American, Pacific Islanders. Any history of cardiovascular disease, hypertension, individuals with polycystic ovarian syndrome, Anybody who has any other disease process or issue that might contribute to insulin resistance, and people who are not physically active, okay? People with pre-diabetes need to be screened annually because we're in a higher risk category for developing type 2 diabetes. Gestational diabetes, individuals who've had gestational diabetes in the past need to be screened lifelong, minimum of every 3 years. And then anybody who else has any additional risk factors with history of pancreatitis or anything like that. So there is a test that you can take, you can self-take at home to see if you're an additional risk. There's a screening tool that is available on the American Diabetes website. And there's so where you can answer the specific questions. If you score a 5 or higher on this, it means that you're at high risk for developing type 2 diabetes, and it will help conversation with you and your healthcare provider for screening. So kind of getting into a little bit more about what diabetes is and diabetes management. I always want people to understand the why behind things, and that helps you have a little bit more buy-in to task manage or the skills needed to manage the diabetes. So what causes the blood sugar to rise? So there's 2 sources of sugar that are regulated. So the liver releases sugar. So that's part of one of the things where our body always needs a little bit of energy. So your liver is constantly releasing a little bit of sugar. And then the other source that a lot of people are probably familiar with this one is food. So carbohydrates, when we eat them, they break down, turn into sugar, the blood sugar goes up. So those are 2 sources of sugar that the body uses. And that's a lot of times it's an important piece to understand too, because a lot of times when we go over medications and things like that, that's also important to know because different medications will target those different sources of sugar. So once the sugar is released in the bloodstream, it's utilized by the cells through insulin. So the pancreas produces insulin, and then you have a receptor on the outside of the cell that when insulin binds to, that's what allows glucose to move from the bloodstream to get into the cell for energy, okay? So it's kind of like using the insulin's kind of like the key, and the receptor is kind of like the keyhole that's going to unlock that door and allow sugar to move from the bloodstream and enter into the cell for energy. So this process and that receptor and the insulin is usually where things are where things are identified with having issues. So like for type 2 diabetes, for example, is insulin resistance is the main issue, okay? So the insulin is resistant to the receptor. So what happens is that the insulin doesn't bind correctly. So instead of the sugar going into the cell like it's supposed to, it bounces off the cell and stays in the bloodstream. So that way, when the blood sugar is tested, the levels are higher than they're supposed to be because the cells aren't utilizing the energy they need, okay? And so glucose regulation is really important. So so the body gets the energy it needs, but also avoid any complications from high blood sugars. So individuals with type 1 diabetes is an autoimmune disorder. So people with type 1, the beta cells start breaking down or dysfunctional to where they stop working. So that's what happens is that, and those beta cells are the cells that produce insulin. So people with type 1 will stop making insulin, okay? So it's a production issue. So that's why they will need insulin lifelong. So for testing for type 1 specifically, because it's an autoimmune disorder, there's antibodies they test for. So common antibodies that they'll test for is IgA2, GAD antibodies, zinc transporter, islet cell antibodies. And so that way, if a provider is suspicious or suspecting type 1 diagnosis, they can send off for antibodies to confirm that diagnosis. Gestational diabetes. Gestational diabetes is a result of hormonal changes during pregnancy. So those placental hormones often will cause individuals to become insulin resistant. So, and then we find a lot of people are either predispositioned to have gestational diabetes. Weight likely plays a role into it as well. Individuals who have had gestational diabetes are also at higher risk for developing type 2 diabetes later in life. So that's why it's also very important to have routine screening after delivery and then continue in lifelong to catch up capture that diagnosis. And women who are going through pregnancy, a lot of times their insulin resistance will triple towards the end of the pregnancy. So, so that's one of the things. And women who end up easily using insulin during pregnancy, their insulin requirements can triple during that. So they need extra monitoring and work during the process. Most women can manage through lifestyle changes. 70 to 80% of women can manage through exercise and nutrition. So there are a few other types of diabetes, and there's actually a couple that I left off, but they're so rare I just didn't even put them on here. But there's pancreatic diabetes. This is, I explained, as kind of as a result, something was going on with the pancreas that it affected the way the insulin was produced. So pancreatitis, for example, if somebody has pancreatitis, sometimes that because it's a disease of the pancreas, and that's where the beta cells live, and they can affect the production. There's other things that can happen with the pancreas that can affect production. There's another one that's called monogenic diabetes. This affects it's a dysfunction of the beta cells that produce insulin. Usually onset is after age 25 years. So a lot of these individuals have very little insulin requirements, and some of them can usually be managed on oral agents. But there's like 14 different types of MODI. LADA, which is latent autoimmune diabetes. And this is basically type 1. So most individuals with type 1 are diagnosed as younger individuals or kids, but it doesn't, there are adults that can be diagnosed with type 1. Generally, it's after the age of 35. And they're what we call the honeymoon phase, where the body stops producing insulin. Usually these individuals have a longer honeymoon phase where they can still produce a little bit of insulin. Usually it's about 6 months after diagnosis. So if somebody and a lot of times these patients get misdiagnosed with type 2, and then later like something's just not right, and then where things aren't matching up with doses or level of suspicion of insulin resistance, where then they're usually a lot of times they'll get further screening and then the autoimmune disorder diagnosis. So, and they will have, because it's an autoimmune disorder, they will have positive antibodies that will confirm that diagnosis. CFRD, which is cystic fibrosis related diabetes. This is the result of a deficit in the cystic fibrosis regulatory gene that causes dysfunction of the beta cell. So those are kind of the high level overview of the different types of diabetes. So what can be done to prevent or delay onset? So some of these situations, if it's an autoimmune disorder, there's not really anything you can do to prevent that. Okay, so not all diabetes are preventable. And then even with some type 2 diabetes, because there likely is a genetic role that plays in there, some of those can't be prevented either. But what you can do is delay onset with some of these. And some type 2 diabetes we can, because of the level of insulin resistance is so low, a lot of times these individuals can be held off with management with medications. So looking at the opportunities. So regardless of when somebody's diagnosed or delaying onset, all of diabetes management as a foundation is looking for opportunities for being active, exercising, eating healthy, and managing weight. Okay, so if there's opportunities for weight loss, looking at for a healthy weight, because the more abdominal fat and things we have, the more insulin resistance will be present. Okay, so those are all the opportunities will go towards looking at what opportunities there are for weight management. So diabetes is manageable, and that's one of the pieces that's really, really important to understand. There's a lot of diseases out there that they are what they are, but one of the cool things about diabetes is that people with diabetes have a lot of control. Doesn't mean that it's not frustrating at times to manage, but it's definitely manageable. So successful management, what I always tell people is successful management comes through empowering. You have to know, there's a knowledge part of it, because if you don't know the strategies or the opportunities or how the medications work, then you're going to get frustrated. So knowledge is the first part. Support. is an important aspect of it because diabetes is lifelong. Anytime you're dealing with an illness that requires long life management or strategies, you're running a marathon. So you want to be able to have support to keep pushing through that. Also commitment with goals. And that's one of the things when we go through our program, we talk about how to apply SMART goals. To try not to start what I classify as trying to tackle world hunger. We don't want to do that. We want to prioritize our goals and set our goals and set SMART goals. And then also self-management tools, understanding how to utilize your tools. All right, so these are the self-care tools. And again, we're going to do a high-level overview of this. So I'm going to give you a good introduction to all the different tools. So just kind of give you an idea. A lot of times our program, and then we'll do each class is 3 hours. So we're going to do our time today. So, all right. So healthy eating, being active, monitoring your blood sugars and looking at what those levels mean, taking medications, reducing risk and healthy coping. So I always start off with healthy eating first because number one question whenever I ask somebody what their motivation is for a session, they all want to know, what can I eat? What am I allowed to eat? I've heard a lot of misinformation. I've heard a lot of myths out there. There's so many different pieces out there what we've heard. And I can tell you, I personally have heard some bad information too. So what can I eat? So and eating is very personal. There's not a single cultural event that does not involve food. So food is very personal too. So the goal with eating is to eat healthy to feel your best, okay? We want to identify foods in balanced portions, go for lean proteins, fruits and vegetables, avoiding foods that are over-processed or have a lot of added sugar in them is the overall goal. So some basic nutrition, just to make sure we're starting off with a good foundation. So the different food groups are proteins, fats, carbohydrates are the main ones we get energy from, and then non-starchy vegetables. So lean proteins like fish, poultry, eggs, cheese, things like that are good sources of lean nutrients. Non-starchy vegetables, I always try to go over those with people. So if you don't like veggies, try a new one every couple weeks or so to see if there's something that you might all of a sudden like. So vegetables, non-starchy vegetables are a great resource for vitamins and fiber, and you don't have to do a lot of math when you're counting carbs with those either. So it's a good way to still get a full plate of food, but not overdoing it on things that increase your blood sugar. And then carbohydrates, and then we'll talk a lot about carbs, but the overall goal is healthy balance. But carbohydrates are the only food that will increase your blood sugar. So being able to identify those sources of carbs first, like breads, pastas, rice, milk, yogurt, obviously sweets, a lot of condiments like ketchup and barbecue sauce and things like that also have carbohydrates in them. So when you're building your plate or your food planning or meal planning, this is an idea of a way to go balance. This is what we call the plate method. And this is an example that's provided by the American Diabetes Association. So starting with a quarter of the plate as lean protein, picking some non-starchy vegetables, and then the quarter of the plate is your carb choice. So you still have a full plate of food, and it can be the foods that you enjoy, but it's still like keeping the carbohydrates for the group that's going to increase the blood sugar to a quarter of the plate. And then we also kind of go over ways to kind of estimate. So if you have, if somebody is open to carb counting or are doing carb counting for their medication plans, sometimes you get into situations where you might have to estimate, or if you don't have measuring cups available. So one of the good ways to kind of estimate is closed fist is about 1 cup. Now it's an estimate. My fist is going to be very different than some other individuals' fists. So this, again, it's just an estimate, but if you don't have a measuring cup with you, that's a good way. Nutrition facts the labels are getting a lot better. For this purpose, I'm not going to go into all the information on the nutrition fact, but for diabetes, one of the things that we really look at is carbohydrates, what foods, the label can tell you on there what foods are going to increase your blood sugar. So always look at the serving size first. Serving size for this example, 15 crackers. And you also look at serving per container. Certain packaging, even something looks like it might be a single serve packaging, make sure you double check that label. They get sneaky sometimes. I've gotten caught on that a couple times where I thought there was a soup that was really delicious. I'm like, oh, that label is not right. And sure enough, I flipped it back around and it was 2 servings for one little container. So looking at that first, and then looking at your total carbohydrates. So in this example, 15 crackers would be 22 carbs. Okay, so if I had 30 crackers, then I'd be eating 44 grams of carbs. So looking at that, being informed. And reading labels is really eye-opening experience. I remember when I first started carb counting, I thought I was like, oh, my diet's pretty good. I've got a pretty good foundation. I started measuring and counting. Oh, I found all sorts of opportunities. So if you've never carb counted before and you're interested, it's a very eye-opening experience. And then, so carb counting is great to let you know what you're putting what's in the product that might increase your blood sugar. But carbs are definitely still needed. Carbohydrates are part of where we get our energy from. Our brain only functions off of sugar. So it's still important to include carbohydrates in your meal. But you want to kind of spread them out. Okay. I don't want to eat all of my carbs that I need for the entire day at one meal, because that would increase the blood sugar too high. That would cause a spike, especially for somebody with diabetes. Okay. So you want to spread out those carbohydrates. Okay. So breakfast, lunch, dinner, kind of getting something routinely. The other thing is, remember that liver had a job. One of the liver's job was to release sugar. Okay. So if you go long periods without eating, the liver starts releasing sugar, and in some cases over releases sugar. So eating routinely, breakfast, lunch, and dinner will kind of keep the hepatic glucose production in check, but it also kind of keeps you eating and overdoing your portion. So if somebody goes long periods without eating, if I didn't eat breakfast or lunch, what do you think is going to happen at dinner time? I'm going to be pretty darn hungry. I'm not going to stick to the amount of carbs I'm probably going to want to eat. Okay, that sets up a recipe for what we call binge eating, where you're starving, your blood sugar's crashing, you're going to want to eat, and you're not going to care how much you're going to eat. So trying to set yourself up for good habits and avoiding those binge eating situations. Okay, so eating routinely, incorporating snacks if you need to. So for when you're doing some meal planning, start with a lean protein. So if you're like, okay, that's great, but I don't like doing math in my meals. So where to start? So pick one sort of the protein first. Okay, usually starting there and building your way towards the carbs, saving the carbs for last. Okay, so pick your lean protein, whether it's chicken, salmon, tenderloin, whatever you're picking. And then pick your non-starchy vegetables. Okay, so whatever non-starchy vegetable you like. It could be a salad, green beans, broccoli, asparagus. Again, I'm very picking a lot of things that I like, but you can insert whatever non-starchy vegetable you like in your meal. And then your carb choice. Okay, so whether it's rice or potatoes or a dinner roll, whatever, or corn, or some of those starchy vegetables that you might like, those are okay to put there. But again, kind of keeping that to a quarter of your plate or your carb portions if you're counting. So the other tool, so we've got nutrition is one tool that we have in our toolkit. The other tool we have is being active. Okay, routine exercise, besides helping with blood sugar management, there's a lot of benefits with exercise and routine exercise. So it helps with circulation, it helps with bone health. There's also, you get endorphins released when you exercise too, so you get to feel good. But blood glucose levels it's a good tool to help balance too. Okay. So blood glucose, so you have proteins in your muscles that help with uptake of sugar. They will last for about, when you start exercising, they help with the uptake for up to 48 hours. Okay. So it's a routine. It's good to get routine exercise. So try to avoid taking more than 2 days off from exercise. Okay. So adults, what's recommended is 150 minutes per week. Okay. So 30 minutes, 5 days out of the week. Okay. And again, trying to avoid greater than 2 days. Resistance training also is a great resource too. This also can actually help with even better than cardio to help with the glucose uptake. So monitoring blood sugar levels are very, very important. Okay. I always tell people, I'm like, if you're trying to lose weight, you get on the scale. If you're wanting to know if your diabetes is regulated, checking your blood sugar. It's an important tool to kind of know if your treatment plan's working. It's a great communication tool between you and your provider to let them know if there anything needs to be adjusted, or fine tuning your plan. And then sometimes people need to make decisions based on their treatment plan. So checking blood sugar. So that's really important tool. So there's a couple of different ways for monitoring blood sugar levels. There's the traditional glucose monitoring, where you prick the finger, you put the blood drop on the strip, tells you a number. So that's traditional blood sugar monitoring that measures off of capillary blood samples. There's continuous glucose meters. If y'all watch TV at all, you've probably seen, they probably could get it to you through your sleep now too, but there's glucose monitoring or continuous glucose monitors. Those are great resources tool as well. And then there's the hemoglobin A1C that tells us the average blood sugar for the past 2 to 3 months. So there's all sorts of great different ways of monitoring blood sugars. So with blood sugar monitoring, with traditional monitoring, a lot of questions we get is, how often should I test? Well, number one time that you want to check is fasting before you eat breakfast. So that after the longest period you've gone without eating, or if it's overnight, waking up first thing in the morning. The target for people with diabetes is have that blood sugar range of 80 to 130. And this is basically testing to see how that, it seems all the treatment plans, or most of the treatment plans, will target the hepatic glucose production, or targeting that the sugar from the liver. Okay. Because if we can get that one in check, all the other high numbers usually kind of fall down throughout the day. The other time that we recommend for people to test, now again, this is, everybody has different treatment plans. Diabetes, I always tell people, is not cookie cutter. People might need to have individual treatment plans. So if somebody's medication plans have them testing differently, then that's absolutely indicated. But the other thing that we suggest for people is what's called testing in pairs. So testing in pairs, well, if you're wanting to see how you're doing as far as your carb balance in your meals, or if somebody's on medication to help them process their sugar with their meals, it's called, we can recommend testing before meal and then post meal to see if those high numbers are staying in target. So that's the other thing that we can do. Or if you're wanting to know, how did this exercise impact my blood sugar? You can test before and after exercise to kind of see how you're doing with that. It's a way to get some immediate feedback on what your interventions you're doing. The goal, if you're testing before meal and after meal, it's 2 hours after meal, and we're trying to keep those high post-meal blood sugar values less than 180. That's the ultimate goal. Okay. If you're not at target before you test, what we're trying not to do is get more than a 50-point jump. Okay. So I'm like, I'm testing my blood sugars 150 before I eat. So what am I doing? I'm like, listen, I'm trying to keep it under 50-point jump. Okay. So, and if it is not, if you're like, I'm eating the right amount of portions, but my blood sugar is still jumping up, that's a good conversation. You just drilled down and got some more information to have a conversation with your provider. Continuous glucose meters, or CGMs, these are incredibly helpful. They're really cool devices. So what they do is they give a constant reading of the blood sugar value, gives updated values pretty quickly, every 5 minutes or so. They're setting a new value. So this constant monitoring, the benefits with these is people require less finger sticks. Some of them don't need any finger sticks at all. And they can monitor, they go to a transmitter, so they can, a lot of times people can use their phones as a receiver and see their blood sugars in real time. The neat thing about this is it gives people predictive alerts. So if somebody has trend alerts with this, so if somebody tested or saw their blood sugar was 100, they're like, oh, well, going back to what you said a minute ago, 100 was in targeted range. That sounds great. But what happens with CGMs is they'll give a predictive. So if I had 2 arrows down with 100, that's telling me in a matter of like 15 to 30 minutes, you're going to have a low blood sugar. So that would trigger a different intervention for the person wearing the device. So if they knew that their blood sugar was trending down, they would hopefully eat a snack to get that blood sugar from preventing that low from occurring. So it helps prevent lows. It does give alerts to people wearing the devices if they're having a low. It also gives alerts for highs too. So it lets people know, hey, you know what, you should not have probably had that extra piece of pie. You know, it gives some people immediate feedback too on what their blood sugars are doing. So who can get the CGM? People with type 1, type 2 can definitely get them, and just ask your doctor about it. There are some off-label uses with CGMs now. You can see them on TV all the time now too. There are people already using them for dieting and weight loss and things like that too. Insurance companies, I think are covering that right now, but you can also see them monitored for off-label use too. So the way that CGMs work is that there's a sensor that goes into the skin. It does not, so when you prick a finger, that's measuring capillary blood. The CGM is reading interstitial blood sugar value. And then that sensor sends it to a transmitter, and then the transmitter sends it to the receiver. So the receiver can be either a reader, like what we have down here on the bottom, or it might be somebody's phone being as a receiver. And sometimes people need to reinforce the sites. Oops, I forgot there was a mic there. Some people might need to reinforce those sites. So sometimes additional tape or covers and stuff like that will also be helpful, especially in the summertime when it's a little hotter outside. And then the hemoglobin A1C, this is again that lab value that tells the average of the blood sugar for the past 2 to 3 months. So generally these blood tests are not drawn more frequently than every 3 months because it's measuring off of the percentage of sugar that's covered off the red blood cells. Red blood cells only stay alive for 2 to 3 months. So there's not really a benefit in monitoring that more frequently, but that's where we get that information from. So an A1C can be, it has another part that comes with that lab is that we can estimate what the average blood sugar is. So an example of somebody with an A1 6.5 means that their estimated average blood sugar for the past 2 to 3 months has been 140. Okay, so that kind of gives us an idea of where they're averaging. So the other thing to keep in mind is that one of the things with management strategies is managing acute complications. So acute complications would be hypo and hyperglycemia. Okay, blood sugars fluctuate normally, but what we want to try to manage is when they go too low, recognizing those symptoms and know what to do, and the same thing if they go too high, knowing what those symptoms are and what the interventions need to be done to fix it. So hypoglycemia or low blood sugar, symptoms associated with it are sleepy, shaky, sweaty, anxious, irritable. I call it hangry. People get really grumpy. Lack of coordination, irritability. Those are often things. And remember, your brain cells all function on sugar. Sometimes people get confused or what we might think of absent-minded. So any blood sugar less than 70 is considered a low blood sugar. So contributing factors or causes that might cause a low blood sugar, not eating enough. So not eating enough carbohydrates or going long periods without eating. Even somebody without diabetes can have a low blood sugar if they go too long without eating, okay? So making sure to try to avoid skipping meals. Too much insulin, and this might be a production issue, or it might be a dosing issue, or a timing of medication. So there's something that contributes to a mixed match balance between not enough carbs and too much insulin. Extended physical activity. So you're like, but wait a second, Courtney, you just said exercise is good. Exercise is good, and I still encourage that, okay? But it's managing exercise to prevent a low, okay? So extended physical activity, remember, we're gonna burn more sugar. So when you're burning more sugar, you wanna be alert that you have enough, what I call fuel in the tank. You wanna make sure you have extra energy for that activity. But as you're burning more, you want it to be aware to monitor, to look out for low blood sugars. Alcohol also on an empty stomach can contribute to a low blood sugar as well. So if for any reason you have symptoms of a low blood sugar, we do want you to check to confirm what you're feeling is in fact a low blood sugar. There are other things that can cause these symptoms as well. So you want to make sure that you're checking your blood sugar to confirm that you're in fact having a low blood sugar. If for some reason you don't have a monitor on you to check to confirm and you suspect that you're having a low blood sugar, go ahead and treat it. Okay, because the treatment for low blood sugar is going to increase your blood sugar, but it's not going to increase it to them so much that it's going to cause you other problems. Okay, but it would be nice to capture and confirm what you are feeling. So low blood sugar treatment, we call the rule of 15. 15 grams of simple carbs and then recheck in 15 minutes. Okay, so this is also what I lovingly refer to as the anti-knee-jerk rule. Okay, so low blood sugars do not feel good. People that are experiencing low blood sugars, again, they're going to want to eat or drink something, and they're not going to really care how much they eat or drink, but we want you to care. Okay, because what's going to happen is it's very easy to take a blood sugar that's a little low and then overcompensate. And now you're like, now I've swung the other direction. Okay, and we don't want to have those big swings because now we're starting to dig out the high blood sugars. And then you get onto this roller coaster. And roller coastering blood sugars do not feel good. Plus they're frustrating. So for 15 grams of simple carbs. So examples of that would be half a cup of juice. It could be glucose tablets. I encourage people to get glucose tablets. You can get a tube of those for $1 at Walmart. I don't work for Walmart, but those are the cheapest ones that I found so far. But those are good. They're shelf stable. They don't go bad. They're not tempting. If I had 4 pieces of hard candy, I can guarantee they're not going to be there at the end of the day. So you want something to be there when you need it, when you're having a load too. So something that you can kind of put around at different places. Waiting 15 minutes, giving that sugar a chance to your stomach to absorb it, your heart to pump it around, get it to the brain and say, okay, you feel better now. Okay. So waiting 15 minutes, which when you don't feel good, sometimes 15 minutes can feel like a really long time. So waiting 15 minutes and then retesting to confirm that you're back out of the danger zone and back in that targeted range. Okay. So once you're in that targeted range, you want to prevent that low blood sugar from reoccurring and dipping back down again. So if you're going to eat a meal within an hour, that's fine. You don't have to do anything else. Just make sure you eat your meal when it comes back when it's time. If you anticipate it being longer than an hour before you eat, please have a snack. So eating something with some slow acting carbs. So like peanut butter crackers, cheese crackers, something like that that's got some complex carbohydrates in it and some protein to kind of slow down the release of sugar. So I always tell people, I'm like, you want diabetes to fit to you, not you trying to fit to diabetes. So what that means is that we have to plan ahead. We have to be able to problem solve and have the tools to problem solve when we need to. So always carry a source of snacks with you and low blood sugar treatments. Okay. So if something happens and you're like, I've got a million doctor's appointments today, I'm late for having lunch. If you go long periods without eating, it's going to put you at risk for low. So making sure that you have a snack with you or something to treat a low. So high blood sugars or hyperglycemia. So this is classified as blood sugars greater than 180 after a meal or blood sugars greater than 130 fasting. Okay. So symptoms of high blood sugars are increased thirst, frequent urination, fatigue, headaches, weakness can be another one, dry mouth, blurry vision. Those are all symptoms of high blood sugars. Okay. And sometimes people don't really get symptomatic with these until they're in the 200s. So that's why a lot of times people don't even catch the symptoms for early diagnosis of diabetes. Okay. So contributing factors, too many carbs. Okay. So carbohydrates, again, they turn into sugar. If we have too many of them, the blood sugar can go up too high. Okay. Not enough insulin. So again, it's that balance of insulin available and processing sugar and carb load. Okay. Illness and infection. So it's not all about the food. There's other things that can drive sugar up too. So illness and infection can increase sugars. Stress can increase sugar. I was trialing out a CGM and I got super stressed out at work. I had a bunch of stuff going on and I was impressed at how high the blood sugars can spike up from stress. So stress response is definitely one of them. Okay. So if you are noticing persistently elevated blood sugars, it's really important to talk to your provider to make sure you're getting that addressed. Less active than normal is another contributing factor. So remember, exercise helps you burn. You want to exercise routinely. So if you go longer than those 2 days, what can happen is you're not burning them as much, so it's going to be higher. So what can you do for high blood sugars? Okay, I always, look back and see what contributed to it, understand that. But in the meantime, if you have what's called correctional insulin available or sliding scale, that's been prescribed by your provider, then you can use that. The most important thing, or one of the most important things, is water, hydration. Water, 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 water. Okay, at least 1 glass of water every hour. Okay, during that acute period. What happens is that even though, if you think back to the symptoms, people are drinking more water, but they're urinating. There's a frequent urination is one of the symptoms or side effects of having high blood sugars. Even though somebody is drinking more, they're going to urinate out more than they take in. Okay, their body, those kidneys are trying to clean out that excess sugar. Okay, so it's really important to stay hydrated. If you can tolerate exercise, remember we learned exercise will help burn off some sugar. So, but we don't want heavy exercise. Light to moderate activity, like going for a walk, is another great resource for lowering those blood sugars back down. Okay. So with medications, often people with diabetes, so lifestyle management is always a foundation. Some people need medications to help process. This particular talk, I'm not going to go into each different classes. There's like a gazillion of them. And the way the different ones work. So I'm going to give you some key points to think about. And again, diabetes is very individualized. So we want to make sure that you understand your medication plan. So some key points with medication, and really this applies to any medication. So I think this is just some good information. Understanding your medication plan. I know a lot of times when I'm working with individuals, some of the mistakes or some of the frustrations come from not fully understanding how to use their medications correctly. Some of the timing of the medication. So making sure you understand your medication plan. Talk with your provider about any side effects. I've seen some people are like, they've classified themselves, and I don't like this word, as non-compliance. Okay. So if they're finding something why you're not taking that medication, is it the side effects? Are you experiencing something that's making you not want to take that medication? That's important to talk to your provider about so that the plan can change. Okay, or be adjusted or look for other opportunities for management. Okay, understanding those side effects. If you have stopped taking them for any reason, you need to make sure you let your provider know. Keep an updated medication list of names, dosages, times, all those good things to know, including over-the-counter medications. Do not rely on your memory. I can tell you, I try that sometimes and it never goes well. So keep an updated list of your medications. Fill your prescriptions after your appointment. That's another good solid piece of just advice, because things are going to happen. Things are going to get busy, and then something else is going to come up. You want to implement your new treatment plan that day. Okay. If you have any barriers to being able to implement it that day, you need to let them know. And that way, if you do get to the pharmacy, you're like, you know what, I thought this was going to be covered and it's not, you'll let your provider know too. So that's going to catch any of those things early on too. And then working with your pharmacist. I think a lot of times people forget how helpful and different resources that the pharmacist has. And they're there for, counseling, and they can help you troubleshoot cost programs and things like that too. And then taking your medications correctly. It sounds easier said than done sometimes, but looking to your routine, looking at finding opportunities within your routine to where it fits. So if you're finding that, a medication you take every night, you remember when you're laying down in bed, see if it's safe to do so, just keep that medication on your nightstand. Try to get things into your routine so it can help you be compliant with that, or setting alarms or different things. And then reward yourself when you do it correctly. So problem solving. So problem solving is definitely something that we work through on the program. There's different things or situations that can come up where you'll need to problem solve. So I'm trying to identify if a problem does occur, try to identify it. If you can identify a potential problem before, that's great. But what changed? Because usually what triggers a problem is something changed. Okay. I guess a lot of times people are like, oh, I started having low blood sugars all the way, but my medication didn't change. I'm like, okay, well, did you start exercising more? Did you start changing the way you were eating? Did you make significant changes? So if you went from eating 90 grams of carbs every meal to now you're eating 30, that's a big change. So those are things that you kind of have to think about. What things what changed? Or are you anticipating change? So anticipating change. So a lot of things with diabetes management are routines. So eating, exercising, taking medication, a lot of things are routines. So situations that routines might change, going on vacation. So a lot of times, like if you were going to go to like Disney or something like that, you might be walking more. So you want to be able to make sure that you have snacks available on that trip. So where you can prevent a low blood sugar or test more frequently, or make sure you have low blood sugar treatments available. Looking for those things. Or are you going to have like a time where, you might have, different diet that you might need, okay, or holidays coming up, okay. Finding a solution. Did you make a mistake or misunderstand something? So this is where, my job I love because I love teaching. I like working with individuals to make sure they understand their plan. Did you misunderstand something? And it happens, life happens. We make mistakes, we misunderstand stuff. So making sure you get the right information. Lifestyle changes, kind of adapting to those sometimes. Looking at what opportunities, if you can implement a solution to prevent that from happening again. And then do you need help coming up with a solution? So part of what our department with working with educators will help problem solving. That I love doing that, and we'll talk about different solutions to implement too. And then taking action. Once you identify something, if you've got a potential solution, and this is one of the things I see a lot of people want to do, they want to try all their solutions. Don't do that. Okay, because then you won't know what works. So try to stick with one solution. If that doesn't work, then you've got another tool that you can try. So stress management, we talked about too, can increase the blood sugar. This is very, very important. So stress plays an important role, can increase the blood sugar. So what happens is the adrenal glands produce epinephrine, glucagon, growth hormone, and cortisol. All of those things will result in increasing blood sugars. Okay, so stress management is important. Okay, so how is everybody coping? Everybody coping well? Opportunities for improvement there. So whether you have diabetes or you know somebody with diabetes, so likely 1 out of 10 individuals have diabetes, so you probably know somebody with diabetes. Just keep in mind that they have experienced some type of stress, or diabetes burnout or depression, or just plain stress related to other things. But diabetes can be stressful. It can be frustrating, definitely. So people with diabetes are 2 to 3 times likely to have depression than people without diabetes. So there's definitely a correlation between diabetes and depression. So just kind of keep in mind that stress management is really important with diabetes, okay? So common stressors for people with diabetes, talking about diabetes with loved ones. This is a big one. I've observed it many times in sessions, and I've observed it at family, at different things. Number one of the most common stressors is family stressing out the individual with diabetes, okay? So diabetes can also be very isolating because they might be the only person in their family that have diabetes. So they're constantly feeling judged about what they're putting in their mouth or snacking or doing stuff. So just being mindful of those conversations. Checking blood sugars, okay? So manual checks sometimes pinch, sometimes hurt, especially if you catch it just right or wrong, I guess I should say. Testing should not be painful, but occasionally it does pinch. So sometimes they get anxiety with testing their blood sugar manually, or seeing the numbers. So sometimes people don't want to test because they're getting anxiety about what numbers might pop up on that meter. I just remember their numbers. That's helping guide treatment. So checking is going to help move things in the right direction regardless. Counting carbs. Sometimes people don't like doing math. Which I get that too. So sometimes looking at, math, there's a lot of math that can be with diabetes. So some people just don't do like doing that part either. Medication and insulin. And first identify what stressor is there. So if you know that, like, for example, if a family member is stressing out somebody with those conversations, then talk about what the stressor is. Set some boundaries, set some guidelines of how to have those conversations. You matter. Everybody matter. Taking care of self-care is very important. Identifying what helps de-stress. So whether it's finding things you enjoy, whether it's exercising, journaling, coloring, drawing, listening to music, reading a book, finding something that you enjoy that de-stresses. Speaking to a friend or counselor also can be very helpful, or support groups. Everybody's got flyers on their table now for our support groups too. So that's a great resource as well. And then making it a priority, really trying to, a lot of times what happens is that people, again, there's so many different, we talked about the different tools for managing diabetes. Sometimes prioritizing which one is most important can be daunting at times. So trying to get some organization to the management strategies. And if you're finding getting overwhelmed, helping prioritize those pieces. And then, so again, support groups can be very helpful too. So some additional resources, your healthcare provider, please reach out to them if you're having any problems or concerns. Again, our department, people have gone through our program or participated, have had wonderful outcomes. We've had some really, really cool success stories as well too. And, you know, a lot of times people come in thinking that we're going to be judgmental and be like, don't, but we don't. We help you work with managing diabetes. All of our educators are very passionate. And then there's support groups. There's, we have the ones that you have on your tables are for our live support group. We partner with the Alachua County Health Department. The last Wednesday of every month, we have a support group over at the Health Street. So that's an opportunity, but there are some online resources as well. Some of the ones that I think are really good are American Diabetes Association. Their website, Beyond Type 1 and Beyond Type 2 are also really good resources as well. So for diabetes education, specifically, it's recommended for the guidelines is that there's 4 critical times that people need additional education or support with diabetes management. A diagnosis is a big one. Because there's so much information to cover in detail. I just gave you guys an overall high-level view of management. Going into the management, how it fits for the individual is really important. Annually, so those are some of my favorite sessions personally, because I like to, you know, it's a good time to sit back and say, okay, what's working well, celebrate those things. And if we find any opportunities where maybe some behaviors are slipping, we're like, okay, let's reestablish those goals. Let's set some new goals. So going from there, and it's a good opportunity to ask, because it seems like anytime I turn on the TV or read an article or something or journal that there's something new coming out with diabetes. So it's a great opportunity to ask, say, what's new, or what opportunities, what do you think about this? And you can have a dialogue with an educator to kind of figure out if there's something else that can be done. Or if goals are not being met. So that's another thing. When complications occur, how to manage those complications and avoid further complications, and transitions in life. So diabetes education, just so you know, most insurance companies and Medicare, they cover 10 hours the first year of diagnosis or benefit use. And then annually they cover 2 hours every year. Sad part is about nationally 5 to 7% of people with benefits actually use their resources. So this is most situations of covered benefit are told that you have. It's just, I just find it highly underutilized, including here. So if we can help further support you, or you need us as a resource, we do have an education department over at UF Health over at Med Plaza. So there's information, there's brochures out there that Marcia said earlier too. And then we also have more listed on our website, and our contact information is below. Well, I thank you. That's the end of my presentation. I really wanted to thank every one of you guys for coming, whether you're coming for personally to know more about diabetes and management, or for caring for somebody, or just curious to how to further support somebody with diabetes. I really appreciate you taking the time today to come listen.